I think we're ready to start. So good morning once again, thank you so much for joining us. My name is Pamela Rosaura, and for our panel session this morning, I would like to introduce our moderator, Dr. Mfaume. Dr. Mfaume is an experienced public health specialist with 19 years experience working in the field of primary healthcare. He holds a degree in medicine, a master's in public health and business administration. Dr. Mfaume has extensive experience in regional governance management in his different roles as the regional medical officer for Tabora and Korogwe regions, as well as a regional medical officer for Dar es Salaam and Shinyanga, and also as a district medical officer for Tabora and Korogwe districts. He is also a member of the Board of Trustees for Muhimbili National Hospital, as well as the Medical Stores Department. He is currently the Director of Health, Social Welfare, and Nutrition Services at the President's Office of Administration and Local Government. Karibu sana Dr. Mfaume.
Okay, thank you very much, co-moderator Pamela Rosaura. Once again, good morning. I take this opportunity to really appreciate for everyone allocating time and participate in this very important forum. So you are warmly welcome, and we are expecting that the keynote speaker, the panelists, and you as participants at the end of this forum will have fruitful deliberations jointly between the government and the private sector. So, among forums in this year's annual summit, Tanzania summit, forum organized by WeCare Solar, and this forum is in line with the theme of this year's Tanzania Summit, that uniting progress, joining effort for quality healthcare through public-private partnership. So, the health facility electrification for improved maternal and newborn care in Tanzania. That is the forum title. And we all know that maternal and newborn mortality remains a pressing global issue, with over 300,000 mothers and 2.3 million newborns dying annually during and around childbirth. According to the World Health Organization, to combat this crisis, only 27% of health facilities in sub-Saharan Africa have reliable power and electricity. I'm underlining the reliable power and electricity, leaving over 100,000 health facilities to operate in darkness and compromising the quality of care provided to mothers and newborn. World Health Organization estimates that 1 billion people globally rely on healthcare facilities and they get services from reliable power, with 25,000 health facilities in sub-Saharan Africa lacking electricity and 7,000 having unreliable electricity supply. Dear audience, this forum will address critical need for electrification in health facilities, sustainable means of electrifications, with special emphasis on solarization of the health facilities, where many clinics, dispensaries, health centers and hospitals operate without reliable power, affecting patients' care and patients' outcome. The forum will bring together government officials. I will introduce my panelists later, but health partners, healthcare workers working at the front line, but community representatives to discuss the challenges, opportunities in electrifying health facilities. Key topic will include funding mechanism, technological innovations, and sustainability strategies, all aimed at improving the healthcare delivery system through sustainable electrification solutions in Tanzania. Soon, I will introduce our keynote speaker, who is Dr. Katung Ambrose. The keynote speech will address the power gap with a focus on enhancing maternal and newborn health through electrification of health facilities in sub-Saharan Africa. Furthermore, Dr. Katung will highlight global energy for health challenges, the current state of health facility electrification in sub-Saharan Africa, impact on healthcare delivery, and potential solutions. Dear audience, with a great honor, we are now ready to start receiving the keynote speech from our keynote speaker, who is Dr. Katung Ambrose, who is a seasoned public health specialist with over 10 years of experience in maternal and newborn critical services and programs management within the government and the private sector. Dr. Katung holds a degree in Doctor of Medicine and Masters of Public Health. He is currently the Health Regional Director at an institution known as THS, where he plays a pivotal role in enhancing healthcare delivery across multiple African countries. He specialized in health system strengthening, programming focusing on sustainable healthcare delivery improvement. Just to highlight you further, the THS and all the partners who will be engaged in the panel discussions have signed memorandum of understanding reflecting the theme of this year's summit, public-private partnership as a strategy. I humbly now invite Dr. Katung to provide a keynote. Thank you very much.
Thank you very much, moderator and everybody here. I appreciate your presence and open to observe. I will take a few minutes based on the fact that we are running out of time to highlight the gap of energy in relation to maternal and newborn health in sub-Saharan Africa, but also highlight the relationship between the energy gap and survival mothers and newborns. If you could put up the slide, please. Don't be worried about the numbers. We are aware that our Lord had 12 disciples, and I think we are more than that. So be able to progress. So thank you very much. And as mentioned, we're trying to address the gap to enhance maternal and newborn health. I will not go so much to the statistics. Next slide, please. And just highlighting one thing, that according to the WHO in 2020, every 2 minutes, a mother died giving birth, a mother died giving life. Every 2 minutes. Next slide, please. So, the entire statistics that has been mentioned by the moderator highlights that the 30 minutes or 1 hour you spend here, divided by the number of about 30 mothers in sub-Saharan Africa, will be dead, giving life. The number of newborns are about 6,500 on a daily basis. And where are these deaths happening? Mostly in Africa. Mostly in Africa. And what are the determinants of this death? You were aware of the determinants of health. And yesterday we were discussing the role of education, the role of agriculture, in survival of mothers and newborns. But what about the role of energy in addressing the quality of health care in our facilities? Next slide. Next slide, please. Now, I want to take one thing from this side. That 50% of newborn death happen in about 5 countries, sub-Saharan Africa, and corresponds entirely with the number of maternal deaths. And you will see that Tanzania is number 3. So it's not a surprise that it's of Nigeria, DR Congo, Ethiopia, Tanzania, and then of course Uganda comes with the come from Uganda. Our programs are in Nigeria, in Ethiopia, in Tanzania, in Uganda, while they're engaged in DR Congo. So this gives you an idea of where the burden is. Next slide. The moderator mentioned this, that 1 billion people in the world are served by facilities that have unreliable quality support. And so, in the 1 billion people, they are served by 100,000 health facilities. And I don't go Africa, I was going to look at how much money is required to electrify the 100,000 health facilities. And you will notice that there is a very sharp difference between the facilities in the urban and the ones in the rural areas. And we know how many facilities in rural areas and what populations they serve, which is a huge difference. And most of the healthcare services are in the rural areas. They're in the PHCs, in the dispensaries, and the investment there is the lowest. Because we're investing, the cost of buying maybe an EMO machine for theater might be what's required for all the drugs for a PHC for an entire year. So the investment in the lower PHCs is lower, and that's where the highest number of services are happening. Next slide. Next slide. And so here is a typical relationship between maternal mortality and access to energy. If you look at these 2 maps, apart from the difference in color, they're exactly the same. And on my right shows you the maternal mortality with the darker regions of Africa, showing the highest maternal mortality ratios. And on the left, you will see that those areas which are darker are showing you the percentage of the population with no access to electricity. So, very simple to understand that the moment you have electricity in a given community, the probability of having maternal death is quite high. Though we know the specific delays, we've already started and talked about, there are delays around energy access. So if you move it 14 kilometers access facility and you find there is no power, you have additional 14 kilometers. And if you're walking or using a motorcycle, then access becomes the difficult, becomes the challenge, and that causes high possibility of a maternal death. So that's the typical relationship. Next slide. And so the energy to enhance quality health care. And for me, my feeling is that as we are pushing for universal health coverage, then universal electrification should be a fundamental aspect of it. If you're procuring an X-ray machine, an ultrasound machine for a given facility, without understanding the access to energy, then you might be planting a white elephant in that facility, where the X-ray machine will never be unboxed, because it will never be used. So the PHCs address most of the health needs. I think growing up, I grew up in a village, and I can say that there's no time immediately below the age of 15 that I visited the referral hospital. It's mainly the PHCs we're going to, and most of us where we go to. But then we end up equipping and supporting more of the referral facilities, neglecting the last mile health facilities and the PHCs. And so we talk about energy for service delivery. What about the health worker? The issue about motivation, recruitment, retention of health facility of the health workers, this facility is a very big challenge. When I served as the AMO for a rural district in Uganda, we were transferring midwives. The key thing they are telling you, they want to be near the road and near where there is power. 2 things: power and the road infrastructure. So if you move them to a people area where there is no power, will be served for 2 months, 3 months, they resign. The issue about retention of health workers, motivation, morale are very, very important. I'll mention about safety as we go ahead. Next slide. These are 2 pictures of the same midwife in a labor suit preparing to conduct a delivery. And if you look at them, on the side basically it's holding the candle. So imagine this is your sister, this is your mother, this is yourself, and you're waiting to be supported in this kind of setting. The risks to the mother, the risks to the health worker are immense. Next slide. The government has done fundamental investments in extending the grid. But if a facility is 10 kilometers off the grid, what is the cost of the connection? How many poles? How many wires? The cost of the transformer. So let's agree that solar might be the real game changer. It's cost effective, but again, it is more sustainable for environment. And we talk about putting up generators as backup, but I was talking to my colleague and saying, when you're in theater in the middle of a procedure and power goes off, how long does it take to have a generator switched on? Who holds the key? It was the fuel. It was the fuel card. You understand? And you're in the middle of an operation. So you just walk the system, switch it on, and the procedure continues. Next slide. The impact of insufficient power. You will read this for yourself, but I'll give you one comment. If you don't know the value of the light source of your phone, let your power go off at home. Just that light you have on your phone can be the only savior for the night. You'll be able to get everybody their rooms. All together? So to understand the role of light, you must appreciate the challenges of darkness. And so, the insufficient power has big challenges to health workers, to patients, to the facility conditions to providing care. In the era of HIV and infection prevention, how easy is it to prepare an episiotomy when the client is positive and you have to use a torch? You'll be like, I'd rather do this tomorrow. Together, you can't blame the health worker, but also for safety of the health worker, that can be challenging. Next slide. What is our role? For the last 14 years, WeCare Solar has promoted safe motherhood, reduced maternal mortality through designing a robust system. It's easy to use, easy to install, easy to maintain, and be able to provide power for a long time to address energy poverty. Next slide. And that system, we call it the WeCare Solar suitcase right in front of you. It's a small system, it's a simple system, but very rugged, safe, and reliable. We installed systems in parts of Tanzania in 2016, and these are 8 years, and those systems are still functioning without a single battery change. It runs on a lithium battery and is able to provide power for about 5 to 7 years. So with one battery replacement, you can have power for 10 years in that neighbor suite, that theater as backup. It also provides 2 headlamps, which you can, for midwives, they understand what it means to be delivered holding a torch. But with a headlamp, you can make episiotomy repairs, you can deliver it, you can walk through and find medicines, you want to initiate any vaccinations, you want to find a suture, you want to find a glove, they'll be able to help you. You can charge your phone and be able to communicate and refer. Also, you can charge the fetal Doppler and be able to use to detect the fetal heart and know at what point you have to refer. One of the main issues is people tell you there is a fetal distress and they want to do C-section, but then you see what's the heart rate, they don't know it. They're assuming. The system is a busy system. It is not easy to be misused, and it's able to provide basic power and basic devices for a last mile facility with 4 LED lights That light, even if you drop it from the roof down, you won't break it. Extremely resilient, right, and can run for a very, very long time. Next slide. I will invite you to the booth white when we are done. You can take photograph to the source of case. This is a demo. It's a demo. So it's the main system. So how do we work? We design the clean energy system that you mentioned. We work end to end, from design to reaching the last mile facilities, and we partner with the public and the private sector. Early in the years, we did pilots with partners directly, but then from 2016, we began to work with government directly through MOUs, through exemptions, through partnerships, to ensure that we're able to sustain the program. That's very important. And then with capacity building for health workers, for government technicians, for private sector, so that we are able to do maintenance at the level of the facilities. We do research to ensure that we improve our systems and be able to provide the right needs of the community. And so the version you'll see is the third version in the last 10 years. So we keep revising to ensure that we're providing what is needed for the facilities. And the last thing, we ensure that we have a system for operations and maintenance. We don't walk away from the system. We don't install and walk away. We stay and work with the government at the national, at the regional, at the district level to ensure that it provides power for a long time. Next slide. To date, we have installed in 9,200 facilities and impacted over 17 million mothers and newborns. And this is a focus on mothers and newborns, but injuries can be treated. Calibrations can be done using the same lighting, but focusing on the mothers and newborns, about 16.9 million mothers and newborns. And the dark countries is where we're implementing the Light Every Birth initiative. Light Every Birth, the intention is to provide light for every delivery, for every facility that is deserving. And these are national programs happening in Sierra Leone, Liberia, Nigeria, Uganda, Zimbabwe, Malawi, and Tanzania. And the ones which are light yellow, we're providing regional and civil programs as we plan and look for resources to implement larger programs in those countries. I'm almost winding up. Next slide. Just one message from this slide, that we don't look at light as the only input to quality of care, but through complementary programs with other service providers, we have seen maternal mortality go down by 45% average and over 75% reduction for newborn mortality. But then we remember that deliveries happen mainly at night. So if you're able to increase service utilization, then you're providing a chance for improving the quality of care. Next slide. Like I already mentioned, we sustain our programs, and I've mentioned all the capacity building, how we design it technically, the programmatic support, and the financing mechanisms. So fundraising also ensure that we allocate some funds to sustain the program. Next slide. Next slide. We are struggling that by 2030, and this is why we need all of us. We need government, we need partners, financing mechanisms to ensure that we can work together to eradicate energy poverty in health facilities throughout the entire country of Tanzania. And so we look forward to able to partnering and collaborating to ensure that we achieve this goal. Thank you very much.
Well, thank you, Dr. Ambrose. And applaud again to Ambrose. Thank you very much, our keynote speaker, Dr. Ambrose. And for those who have joined us while we've already introduced our forum today is on health facility electrification for improving maternal and newborn care, especially at the primary health care levels. And the suitcase that our keynote speaker was mentioning and projected this one. So when we're talking about solar, it's more than solar. It has accessories for improved quality of care, as I say. It has a Doppler machine, as I say, mass, thermometers, and other equipment. And I used to work in Shinyanga as a regional medical officer. So I'm man with the witness of how these solar suitcases can contribute to the improving quality of care. So it's not like the other solar panels that we put. This goes with the innovation. Thank you very much. And let me now take this opportunity to equally now introduce our panelists. At the end, we'll have time also, if there are any questions, I will invite the keynote speaker and panelists on the stage. We have our first speaker, who is Dr. Omari Sukari Migura. Dr. Omari Sukari Migura is a public health specialist with a 14 years experience in regional administration of government authorities, working in a public service. So has been a district medical officer in various districts in Tanzania, Uyui district being one of them, Ngorongoro, and Arusha district council, where he led the coordination of health services programs as well as providing technical support to the country health management teams. He is currently a regional medical officer for Geita region, where he supports and provides technical support on implementation of health services and system strengthening. Dr. Omari Sukari, first panelist, please welcome to the stage. Our second panelist is Ms. Emakurata Charles. Ms. Emakurata Charles is a senior nurse at Kamena Dispensary, very lower level of care to primary care in Geita district, where she leads the day-to-day operations in the labor ward. Her roles include attending the pregnant women, assisting with deliveries, routine cleaning visits, and providing vaccinations to infants and children under 5. She has 9 years working experience in the primary health care. Ms. Emakurata, please welcome to the stage. Karibu sana Jukwaani Emakurata Charles. Our third panelist is Ms. Pamela Rezaura. Ms. Pamela Rezaura is a development specialist with over 10 years of experience in leading projects across multiple sectors, strategy development, as well as monitoring and evaluation. She holds a degree in sociology and master's in public health. She is currently the country program manager for an institution known as We Care Solar in Tanzania, where she leads the implementation of the innovative solar switchcase programs and also manages the relationship with the government and the other stakeholders. Ms. Pamela Rezaura, please welcome to the stage. And we have Dr. Benatus Sambiri. Dr. Benatus Sambiri is a dental surgeon with over 17 years of experience in clinical service management. Dr. Sambiri also qualification in leadership and management and in public health. He is currently the country director for Solidamet. His career encompasses significant roles in public service, academia, and the development sector, where he has consistently demonstrated innovations in adaptability. He has specialized in program cycle management, child, youth economic empowerment, WASH, and immunization response. He is committed to driving progress in the chat and over-changing environment. Dr. Benatus Sambiri, please welcome to the stage. For the interest of time, my panelists, I want to take this opportunity to welcome you on the stage and just feel comfortable. take a deep breath and exhale. So starting with Dr. Omari Sukari, with the Regional Medical Officer for Geita Regions. My first question is, this is the first question because we'll have a brief second round of questions. How does, with your experience, how does the lack of reliable electricity impact the day-to-day operations and emergency services of health facilities in your regions? That's the first part of my question. But the second part is, what improvements have you observed when facilities, which means health facilities, have access to consistent power and electricity?
Thank you very much, moderator. Good morning, everybody. Yeah, first of all, moderator, allow me to take this opportunity to thank you very much our government of Tanzania for its tremendous efforts to make sure that all villages in this country is electrified. And as all we know that our government have an agency which is particularly working to make sure that electricity are connected to our all villages, and we call it Rural Energy Agency, REA. And the plan is to make sure that in coming 2025, all villages should have electricity. But they have another plan to make sure that all hamlets also they receive electricity coming to 2029. So this is a very biggest plan for the government, at least to electrify all the villages that we have in this country. And going back to the region where I'm coming from, it is almost about more than 95% of all villages are already connected with the national grid. And of course, the government's directed the REA to make sure that whatever distribution of electricity they have done in our village, they have to make sure that all institutions within the village, including the health facilities, have the poles. And the responsibility of the council and the health facilities to make sure they do installation of electricity within the facility. So that is the part of making sure that we have the reliable electricity in our health facilities. And we are sure for the effort made by the government, coming 2025, all the village in this country have reliable electricity. So now going back to the question, we know that, and it is very obvious, and I think Dr. Atungi has already mentioned many of the issues that I was supposed to mention. When we have unreliable electricity, what happened? We know we have WHO building blocks. And if you go through all WHO building blocks, you can see electricity is one of the major and very important components to make sure that we deliver quality of health service provisions. Looking in terms of food service delivery as one of the components of WHO, like here as shown in the picture, in service delivery, we have several machines that we have in our health facilities. We have machines, lab machines, we have radiological machines. All these machines need electricity to run, a reliable source of power to run. So if we don't have that, it means that we cannot be able to investigate our clients, and for sure it will be difficult for a service provider to know exactly what is going into this patient. But again, we know we have the issue of cold chain management. In cold chain, we are looking for vaccination. We need to have reliable power to make sure that we store in a proper room so that the vaccine can remain potent, and the direct, if you vaccinate or immunize our children, now they can be able to protect themselves. So that is another issue. If you don't have reliable electricity, it means that even the storage of our vaccines and some other drugs, which means cold chain, will be affected. But all we know that in our single-use facilities, we need blood, safe blood. So if you don't have reliable electricity, it will be very difficult for us to keep those bloods in a very good body condition so that we can transmit to the patient. And here we are talking about maternal and the newborn health. And these are the ones who actually consume a lot of blood unit in our health facilities. So having reliable electricity, it is very important component to make sure that we improve our healthcare services. But again, looking to other blocks like the HMIS, we cannot be able to operate our HMIS programs if we don't have also reliable electricity. Our routine activities, it depends on the data collection. It depends on the information of the patient that we fill in our THS, etc. So we need to have that. But looking in terms of financing, nowadays we have different systems of financial funds collection, revenue collection. They go to home in after care, which we have in our health facility. So if we don't have reliable electricity, it means that even revenue collection will be in a very difficult situation. In such a way, there will be no accountability for that. So we at the health sector, we think having reliable electricity, it will give us a mileage, it will give a conducive environment for our staff, service provider to work, like a picture we saw in the labor room, that is a midwife who she was attending a pregnant mother. If you use a candle, that will be very difficult for her. If she has a light, it will be very easy for her to conduct whatever procedures she wants to do for pregnant mothers and for our newborn. But we have the last office, everybody knows. We have mortuary nowadays, even to the level of health center. So if you don't have reliable electricity, it means that even our beloved one, who actually want to keep them, we have to preserve them to be, for sure, very difficult for us to take, to provide a quality service. So, Mr. Muleta, that is what I think will be the challenge of having no reliable electricity. But again, if this whole challenge will be solved by having reliable electricity, it means that we are going to be in a position to provide quality of health service as a group. Thank you.
Thank you very much. Thank you very much. Can I come out to our presenter? Yes, just a brief follow-up questions, Dr. Sukari. Yes, this want to wait now your explanation with the theme of this year's Tanzania Summit. That uniting progress, joining efforts for healthcare, the public-private partnership. So with your experience, if you can give us experience from the area that you've been working, what are the enabling environments or the government directives or initiative that currently in place, or with your experience, you are advising to support the electrification of health facilities in Tanzania? And how can this enabling environment directive initiative be strengthening or better implemented through public-private partnership? Just a brief. If you can use a minute, please.
Thank you very much, Moderator. Of course, we know that our government has a very nice policy, the public-private partnership policy. And of course, we as a regions, we as a council from where we're coming from, we are all compliant on the PPP policy and the PPP guideline, whatever it comes. So, by collaborating with the implementing partners through PPP, we can be able to make sure that our facilities receive electricity. As it was mentioned by Dr. Katungi, we have the Care Solar, who actually came into our regions. And this Care Solar, they are not starting from the region, they started from the ministry. Ministry of Health, POH, they have the memorandum of understanding with them to explain what are the responsibility of we care and what are the responsibility as we region, as we partner in terms of electrification in our health facility. These are the guidance, and all of us will comply on that guidance. And whatever implementing partners want to come and join the effort of other implementing partners in terms of electrification, that is a procedure that we comply. And we are very open as we heard from other forums during this Tanzania Summit. What we are saying, implementing partners are not competitors, rather than they are some people who are coming to complement the government effort so that we get quality health service provision within our facility. That's what we are doing. Thank you.
Thank you very much, Dr. Sky, and thank you very much for all these partners who are jointly joining hands with the government, like We Care Solar, in terms of mobilizing resources. We Care Solar has been mobilizing resources from abroad, and their solar switchgears like that is not sold to the S facilities, rather than it's just handed over related to the S facilities, all those accessories. Thank you very much. Now going to my second panelist, Mrs. Immaculata Charles. Immaculata Charles is the nurse midwife working at Kamena Dispensary in Gate. Can you share your experience working in these facilities without reliable power and electricity? And how can electrifications, where available, transform the quality of maternal and newborn care? Immaculata Charles, ukiwa kama ni mtoa huduma za afya ngazi ya chini kabisa ya utoaji wa huduma, unaweza kutupatia uzoefu wako katika kufanya kazi ngazi ya vituo vya kutolea huduma za afya ya msingi, hasa vituo vya afya na zahanati, pasipo uwepo wa uhakika wa nishati ya umeme, na ni jinsi gani uwepo wa umeme pale unapopatikana unaweza kuleta mapinduzi au mabadiliko makubwa katika ubora wa huduma, hasa kwa mama wajawazito, mama waliojifungua na watoto wachanga. Immaculata Charles, kuwa huru kutumia lugha yoyote. You can use English, Swahili, but not use Sukuma language. You are welcome.
Thank you. Asante Dr. Rashidi. Habari za asubuhi. Shikamoo wakubwa. Napenda kuishukuru serikali ya Jamhuri ya Muungano wa Tanzania chini ya Dr. Samia Suluhu Hassan kwa uendelevu wa huduma za utoaji wa umeme vijijini REA na TANESCO, ambao unatusaidia katika kazi zetu za utumishi kwa kuwasaidia kina mama. Vile vile naishukuru ofisi ya RMO na DMO kwa sapoti yao kwa ajili ya kuniwezesha mimi kama mtumishi wa huduma ya afya kwa kuwasaidia wamama wanaojifungua. Napenda kwenda moja kwa moja kwa kusema kwamba mimi nimefanya kazi katika Geita District kwa miaka 10 sasa kama nurse and midwife. Nimekaa katika mazingira ya district kwa miaka 7 at Namalibe Dispensary na miaka 3 katika Kamena Dispensary. Kwa hiyo nina uzoefu wa kuwahudumia mama wajawazito kwa mazingira yasiyo na mwanga wa nishati ya kudumu. Na uzoefu huo kwa miaka 10 sasa, na ninafanya kazi hiyo kwa weledi mkubwa na kwa sapoti kubwa. Changamoto ambayo nakumbana nayo ni pamoja na kukosa security nzuri na pia kukosa confidence ambayo naweza kuifanya kwa 100%, kwa sababu mwanga ni kitu cha muhimu sana. Kwa hiyo ninatumia akili kubwa na nguvu kubwa sana kwa ajili ya kufanya kazi hizi, lakini natumia hasa tochi zenye battery, pia natumia generator kama mafuta yapo, kwa sababu wakati mwingine generator inaweza ikazima, hauna fuel ya kutosha, kwa unatumia torch ya kushika. Kwa pale nakosa usalama wa kazi kwa self contamination, hata inakuwa so safe delivery kwa sababu mwanga unakuwa si wa kukidhi. Kwa hiyo mimi nikipata mwanga mzuri wa kunisaidia kufanya kazi zangu vizuri, nitafanya kazi zangu kwa weledi sana, na nitajitahidi kuongeza namba ya mama wanaokuja kujifungulia katika kituo changu kwa 1% kubwa, kwa sababu wamama wengi wanatakiwa kupata huduma hizi katika stahiki, ambapo pia mwanga inachangia kwa asilimia kubwa. Kwa mama anaweza asije kupata huduma kwa sababu mwanga ni hafifu, kwa anahofia usalama na pia huduma atakazopata si nzuri kwa sababu ya mwanga. Pia itasaidia kuondoa maternal death and newborn death kwa sababu watapata safe delivery ambayo itasaidia katika uchangiaji wa ukuaji wao vizuri na huduma kwa salama. Vile vile nikipata mwanga wa sola utakuwa unanisaidia mimi katika kufanya kazi zangu vizuri, hasa pale ninapomhudumia mama katika swala zima la mpa ile huduma. Mfano mama amepata tea, anatakiwa kushonwa vizuri, kwa itaniweka mimi kuwa comfortable kufanya procedure zangu vizuri kwa ufanisi mkubwa bila kuwa na shida yoyote. Kwa mwanga ni muhimu sana kwa huduma za kina mama, hasa sisi kwa midwife ambao tunafanya kazi katika mazingira yasiyo na mwanga wa kutosha. Vile vile mwanga pia utanisaidia mimi kuwa na namba kubwa ya vifaa tiba, vifaa vitendea kazi nini. Mfano nitakuwa na vifaa ambavyo vitakasa vizuri kwa kutumia mwanga mzuri, hasa wakati wa usiku, hata ninapofanya decontamination kwa ajili ya vifaa vile. Kwa nitakuwa ninaona vizuri sana na kunisaidia mimi prepare safe delivery kwa mama wajawazito wote wanaokuja kujifungua.
Asante sana. Can you applaud for Emakurata with the full-time health worker at the dispensary? She has addressed in very simple language because she has been living those conditions. Sustainability of electricity, the supply is very important, reliable ones. Using a solar can make you efficient use of the resources that you collect at the dispensary level because it's sustainable means. Thank you very much. Now, from an institution, We Care Solar Tanzania. Wapa We Care Solar Tanzania Country Manager, Pamela Lozaura. Pamela Lozaura, how are the organization, We Care Solar, working with the government to address the energy gap, and how will this program be sustained? We know you are not a mere partner who have to sustain, but your contribution towards sustainability. We have that question also directed to the government in the second round with round. What additional areas of partnership do you see that can significantly help address its facility electrification in the country? Ms. Pamela, you're welcome.
Thank you so much, Dr. Palmer, and good morning, everyone. First of all, I would like to commend the government's efforts. As I've already been mentioned, how we are trying to address the health facility and electrification challenges. And through We Care Solar, we work in partnership with the government, where we have signed a partnership agreement with the President's Office, Regional Administration, and the Local Government Authority to implement our Light and Breath initiative. Our Light and Breath initiative aims to reach rural health facilities, the last mile health facilities that are facing electrification challenges with our solar suitcase, which aims to provide reliable lighting as well as power to improve healthcare delivery. And also through this partnership that we work with the government, we work closely with the government to identify where we should go, to prioritize which health facilities we should reach. So we work closely with the regional as well as the district government, as well as the health facilities, where we conduct health facility assessments to identify the health facilities in need. But also we work closely with the government to identify the regions. We know it's a cross-cutting, health facility electrification is a national issue. Despite all the efforts that the government and the different initiatives that have been mentioned, it is still a critical issue, especially in the remote rural health facilities. So we work closely with all those layers to ensure that we reach the hardest to reach facilities, and we provide them, we do the installations of our solar suitcase, which in turn provide reliable power, even in health facilities that are already connected to the grid. We install our solar suitcases as a backup, as a source of making sure that there is reliable power in these facilities that are serving the majority of the population in our country. So this year, through our Light and Breath initiative, we are targeting to reach 2,500 health facilities, the critical health facilities in need of health facility electrification. And this is just a start. As we continue to mobilize resources, as we continue to work with the government, we aim to reach all the health facilities in the rural areas that need our solar suitcase. So, in terms of our collaboration with the government, I just wanted to highlight that this is a government-owned initiative, and we are working closely with the national, the regional, the district, and all the way to the health facilities in order to address this critical challenge. And obviously, we all know sustainability is a key aspect of any program. And in our programs, we try to ensure that as we implement, we have sustainability in the back of our heads. So we ensure that we provide in-country technical, in-country trainings. So we train local solar installers so that they are, we have solar installers in-country that understand our systems, how our systems work, and they're able to provide, to do the troubleshooting, to do the maintenance, and they do not need to rely on external support. So we train local installers. We also train healthcare providers, because the healthcare providers are the ones that manage the solar suitcase on a day-to-day. They're the ones that have to switch it on. They're the ones that have to do any troubleshooting that needs to be done. So we also train healthcare providers, and in doing this, we try to create that sense of ownership. Because once we do the installations, yes, we continue to do the follow-ups, we continue to monitor the functionality of the solar suitcase, but on a day-to-day basis, it's the health facility and the healthcare workers that use this system. So we ensure that we have the in-house, we have the technical skills in-house, and the skills transfer as well is the other aspect that we ensure sustainability. But we also work closely with the government so that our interventions are mainstreamed into government initiatives. If governments are visiting health facilities to conduct routine maintenance, we work closely with them to ensure that they also do the maintenance, or they do the monitoring of the solar suitcase, and then if there are any issues, they are able to communicate with us. So we work with governments to create the ecosystem of support and sustainability to ensure that we don't just focus on the installation, but we focus on the sustainability as well. Long-term sustainability, and as the keynote presenter highlighted during the presentation, that our solar suitcases have been known to last for 10 years without needing any, obviously they might need a change of battery, and these are things that are accessible in the country, but they can last for 10 years without needing major maintenance. The other aspect about additional areas of partnership, obviously, in expanding partnerships across diverse sectors, we're hoping that we can drive sustainability, we can drive scalability, and also we can improve our innovations. Thank you.
Thank you. And applaud for Ms. Pamela. Sustainability, scalability is a very important area. I just remind you, you are also studying the old systems. This coming from the government. And I've asked Pamela, who is representing We Care Solar, about sustainability. It's a tradition that when we're talking about sustainability, we ask the government alone. But when we're designing our programs, projects, let's think of sustainability, a roadmap, both jointly. That's very important. And I reiterate it again. We are not here to promote the products. That is purely the donations from our friends, from joint resource mobilizations that are not selling solar suitcase or a solar system attacking those devices that can assist in quality improvement of services and sending them to the facilities. No, it's merely they are mobilizing funds and handed to the government. Now, going to our final panelist, Dr. Benatus Sambili, who is the country director of an NGO, Solidamed, who has also signed a memorandum of understanding with the government. So, what role do you see partnership between the public and the private sectors playing in accelerating its facility electrification in Tanzania? Please underline the word accelerating its facility acceleration, because despite of this support, still in rural areas there are a lot of facilities that are not yet reached with a similar intervention and have challenges. And what successful models can be replicated or scaled up? Your panelists.
Asante Daktari. Good morning, colleagues. As I've been introduced, I'm the Nabisabili, a director for SSBFD NGO Solidamed. We are working in the rural region in 5 out of 9% of the world. And out of those 5, 4 are categorized to be the rural because they fall in the Kilombero Valley. When I was invited to be part of this panelists, as I asked myself, where are we so far with regard to the rural electrification, and in particular to ensure that the facilities are supplied with the source of power. So I asked for some quick data from the 4 districts we are working, which are categorized as rural, Malinyi, Ulanga, Kilombero, meaning Mlimba, and Ifakara. So we have a total of 160 public and private facilities. Out of those, only 4 are not connected to the national grid, which aligns to what my colleagues have emphasized here. So the efforts can be seen that we are doing a lot to ensure that all those facilities are connected to the national grid or have any source of power. The key point here has been reliability, and I'll be talking on this with regard to partnership. Colleagues, generally, I see partnership like a heartbeat of progress across what we are doing. So without these partnerships, our efforts would be flatline. We have different models, and Dr. Faume, during one of the sessions, first day, a mama session, you emphasized on the 3 delays, right? And today, our emphasis is on the 3rd delay, what happens at the heavy facility. But we call upon, what we are discussing here is not one approach fits all. It's efforts to try to address at different levels, bringing together our efforts so that we can ensure that quality of safe provision is the standard envisioned to be in the near future. While we have this power, we have seen that the standard when you are establishing health facilities, especially those which are providing emergency services, it's a requirement that they have a power backup. And when you go along, all hospitals from the health center which are senior, going to the referral, they have a power backup, and the which one is the generator. I don't know, this is my thinking. Probably they kept the investment for a generator. It's all low at the beginning, but we all know the running costs are different. I'm not saying that generators are bad, but now when you have we have a regular power outage, right? This is a common problem, despite that we are connected to the national grid, and this comes without information. So it expands you in an emergency, whether in the theater or in the labor ward, or even a newborn who is in distress needing oxygen. So when there is power outage, it needs time to go to light the to put on the generator, and that depends if the one who owns the keys is available, because nobody will get the key of the generator and they will know the security cannot keep it open. The other thing, does it have fuel? That is the question. So whenever we have any innovative solution which try to address the issue of emergency, we call upon the Air Force to work together to make sure that this is done. We are talking of partnership. We need to formalize them, as my colleagues say. Once they are formal, they give us an opportunity to share our vision, to put together our visions, put together the resources we have, and then we work together. I put an example. We are working in a certain facility where they are connected to the national grid, and they have the generator, and they have the annual budget for fuel. And we as partner, probably we have a budget for some solar for certain department. Why can't we come together, we bring those resources together so that we can establish something which is feasible, durable, and also is environmental green. We are advocating for the use of solar because of the green energy as far as environmental conservation and the climate change is concerned. So that to make it short, I would say let's embrace technology. Whatever technologies are around, which is suitable, which fits our circumstances, let it put together. Let's work together so that we ensure that each facility has a reliable source of power. In this aspect also there is an element of trust. We have this challenge, sometimes of trust, along the different partners. So I'm not throwing this to anybody, all who are involved in the partnership. Why are we hiding the resources we have? Why can't we put out the resources on the table and we discuss together so that we can address the overarching challenges? So lastly, colleagues, electricity and the power in each facility isn't a luxury, if I were to say. This is a lifetime. So it's a way to go. Let's put together our effort. Let's leverage innovation. This is one example as a power backup, but it's not the total solution. But at least you have something like this during emergency. If anything happens, the procedure should continue while you are still addressing some challenges regarding the power. Thank you.
Thank you, Mike. And now for Ambili. That's very interesting. Let's synergize leverage resources. Let's collaborate. Apart from WICA, so of seen USAID also showing interest, especially in the western regions. Also, mobilizing funding and they're installing solar, not selling solar to the facilities. So that's very important. And we at the government, we are advocating every partner who is here, every interested stakeholders to join hands in accelerating coverage of solar, but coupled with innovation. It's not merely solar. It's a solar that can assist in quality, healthcare improvement with those accessories out of the chain. So just a minute each, please. This time do not increase even a single second. Just a minute. A few, two questions, very brief. Every one of you should listen to these questions because I pass the mic to each one of you. How can the communities, and especially for the government, how can the communities be engaged in the sustainability and the maintenance of electrification projects in their local health facilities? And what strategies are proven effective in ensuring community ownership and long-term success? If I can translate very well in Swahili, ni kwa jinsi gani jamii inaweza kushirikishwa au inapaswa kushirikisha katika uendelevu wa miradi ya nishati ya umeme katika vituo vya kutolea huduma za afya, na sasa usifocus solarization solar na kuchangia gharama ndogo za matengenezo kinga pale vituo vya kutolea huduma vilivyopo katika maeneo yenu au maeneo yao. Ni mikakati gani imedhihirisha kuwa inafanya kazi vyema katika kuhakikisha kuwa umiliki wa miradi ya nishati ya umeme unakuwa uendelevu na hiyo mafanikio ya muda mrefu? That's the first part of my question. The second one is what are the key challenges? And some of these you have already mentioned, so no need to repeat. What are the key challenges and opportunities in resource mobilization or financing for the facility electrification? And how can stakeholders collaboratively address? Some of you have already mentioned this. Collaborate, address these barriers to ensure widespread access to reliable power in these facilities. Ni changamoto zipi kubwa na fursa zilizopo katika upatikanaji wa rasilimali fedha kwa ajili ya uwekaji wa nishati ya umeme au umeme wa jua katika vituo vya kutolea huduma za afya ya msingi? Ni kwa jinsi gani wadau wanaweza kushirikiana dhidi ya vikwazo hivi ili kuongeza upatikanaji wa nishati ya uhakika katika vituo vya kutolea? Just a minute for each one of you. Starting with Dr. Omari Sukari, the Regional Medical Officer for Geita. Welcome.
Thank you very much, moderator. Actually, no question, it's short answer. So what I can say, whatever kind of projects we need to implement, first of all, we need to involve them at the beginning of the project. So if we involve them during planning, if we involve them during implementation, we're sure it will be easier for them once the project is completed. So that will be a way forward to go with whatever project you want to implement in the community, including the electrifications. So what are the opportunities we see? We have the community partners that we have said, public-private partnership. That is an opportunity for us. We have funding for construction of our new health facilities and sometimes innovation. So the component of a power should be one of it, specifically the solar as a backup, but again an opportunity to connect with the national grid for the facility which they don't have it. But we have the opportunity of revenue collection within our facilities. We need to put in place mechanisms where we can be able to collect funds that can support innovation, maintenance, and even installations of various infrastructure that we need in our health facilities. So those are the opportunities that I think we can work together, public, we can work together as private. Thank you.
Thank you very much. And even using the local vendors for solar in our villages, in our streets. That's very important. So it's not the side that you respond. Because time is not our war. I'm told you have only 15 minutes, but that will be fine for. So it's not necessary if the response has already been addressed, not necessary. Tunakurata kama kuna la kuongeza kwa maswali yangu haya.
Daktari, cha kuongeza hapo ni ushirikishaji wa uongozi wa ofisi za vijiji na halmashauri za vijiji na ushirikishwaji katika ofisi za DMO ili kujua kwamba tunapata huduma hii sola kwa ajili ya manufaa ya kituo na kwa ajili ya kununua wajawazito.
Asante sana, ameongea jambo zuri sana. She has mentioned it very well. The council management team are the ones who are planning on any installations. The facilities, they should be involved. During planning, they have a role putting allocating funds in that area. Pamela?
Okay, so
Yes. 30 seconds, please.
Thank you. From a programmatic point of view, this is something that I've already mentioned. We focus more on the in-country trainings, so as to make sure that we have technicians, both from the health facilities, but from the government. So we do train government technicians to make sure that the technology, the technical know-how is left behind even after installations, and people don't need to rely on external, an external technician to address some basic maintenance issues. So that's how we involve the community. But also, and this is something that came up during Pilate's explanation, is that because of because of the unreliable power issues, you find people in the community choose to go further to other facilities so that they can make sure that they get better health services and they do not compromise the quality of care.
Thank you. Well, Donatus.
necessarily giving a mic to someone from the NGO to talk about community engagement is like giving a mic to a seasoned politician. So I want to go to that. We think that practicability, there are serious question mark. I have a last point, which I wrote here. We talk of preparedness in all aspects. We should not be caught unprepared. We should not be caught unprepared. It's in our hands. We have resources, well-established partnership. Let your president. Thank you.
Oh, thank you very much. Can I applaud all my panelists? They are wonderful, massive, excellent. Now it's the time to have questions, clarifications, advice, congratulations, appreciations, critique, or anything from the audience. But just be brief. Don't start narrating a story that before independence it was this like this. Just focus, and if possible, direct your question to each panelist. The first panelist is Dr. Omar Sukari, who is the regional medical officer for Geita. And the second one is Makurata Charles, who is the frontline healthcare workers at the dispensary level. And then Pamela Zaura, who is from We Care Sora. And the last one is Benatus from Sodamex. So be brief, we are now panelists, please take notes. Yes, you're welcome.
Good morning. My name is Dr. Fatma from Ministry of Health, Zanzibar. My question will go directly to the sister at the health facility. First, I would like to congratulate you for your efforts. Working hard.
Makurata, are you comfortable au abadilishe lugha? Dr. Fatma. Dr. Fatma anaomba ongea Kiswahili tu.
Asante. Napenda nimpongeze sana kwa kazi kubwa anayoifanya katika kuimarisha huduma za afya na kuensure anapunguza ile vifo vya mama na mtoto. Lakini pia nataka nijue katika hii health facility anayofanya kazi au dispensary sina mambo ya antenatal care. How is she managing the vaccines in cold chain process?
Let's collect a few questions. Yes, I can see a hand over there, please. The ladies are very vibrant today to ask questions. Yes.
Okay, napenda kumpongeza Makurata and the panelists for a very great discussion. I have one concern. If after the mother is discharged back home, what's the plan? Because she's going back to a place where there is no electricity and she's going to take care of this baby. And the other thing is that what is your plan for partnering with other stakeholders at the place where you are supporting this solar power? And the other thing is about planning. No, kwa Imakulata kwamba plani ni nini huyu mama anaporuhusiwa kwenda nyumbani, kwa sababu kama ni operation na maana ataenda kutunza kidonda sehemu ambayo hakuna umeme na wakati mwingine atahitaji kujihudumia wakati wa usiku. Plani ni nini? The other thing is during construction or building of business facilities. Do you have a system for solar panels? Au inakuja like an emergency wakati hii kwa upande wa serikali? Do you have any plan when you are constructing business facilities to consider the second option about the solar connectivity? Thank you.
Very good question. Thank you very much. Another question? If you can have a maximum of 3 hands. Yes, welcome, gentlemen over there.
Asante, mimi ni ushauri, lakini pia nipongeze panelists kwa discussion nzuri. Lakini moja kwa moja nitajikita kama ifuatavyo. Nilitamani kujua hawa wanaomba taje majina ili wakati wana respond kwa wifi. Sasa kukia sola.
Tuendelee.
Kwamba focus yetu ni katika kazi hii. Lakini sambamba na hilo nitamani pia kuelewa tunajikita kwenye vile vituo ambavyo havina pia yenye umeme kuweka kama ni alternative source of power, kwa maana ya kupunguza gharama za uzalishaji. Tunafahamu gharama za umeme huwezi kupunguza gharama za sola, na ili kupunguza gharama za uzalishaji kwenye kituo, ili fedha hizo zielekezwe kwenye maeneo mengine, kuna haja ya kuangalia utaratibu ili sasa tuwe na alternative pale na lazima kutumia umeme kuweka kitu na lazima kutumia sola kupunguza gharama za uendeshaji.
Asante sana. Last question, if any. Okay. Swali kwa mamlaka kama tutakuwepo kwa Kiswahili tafadhali.
Sawa, asante. The question goes to Pamela. I've seen that this was more deaths are happening to newborns rather than the mothers, but this one has just equipped itself to help the mother. What about the child? I know most of the things that Help Baby Breathe brings on to does not need a lot of power, but at least you need the pathosimeter, maybe the CPAP. I think in your next project, maybe you could consider that. But again, I've seen that most of these projects that are aligned with the government, they are at first they're very overwhelming, like they can bring the devices or the equipment, but you have talked a lot about sustainability. But what about the consumables? Are you the only single source of these consumables? Because most of the time you can see, like the remote say, you can see some of the instruments are there, but they are unboxed. They are still not used. Maybe only one thing that is missing in this equipment, then the whole system is not working. What about yours? Have you considered something like that?
Very good questions. The last question on advocating partners who are here to join hands in accelerating, reaching as many primary care facilities as possible. No any other. Because the question is not only directed to the panelists. Somebody can stand and say, I have the audience to join hands with that. That's all. Otherwise, if you don't know any other question, let's allow the panelists to feel free to respond, please. The time is not on our side. Because we have few activities to accomplish within this forum. Anyone can start now. Anyone?
Okay, I can start to address the questions that were directly addressed to me. So one of the questions is about what is the plan for collaborating with other stakeholders in the areas where we work. So as mentioned, we are using this platform to call upon all stakeholders that can join us in this fight for addressing the electrification issues. So we work, as already mentioned, we work with government, we work with the private sector, and we are calling other partners to join us. The other question was which have prioritization. So obviously, before we begin our interventions, we do a needs assessment, and we are fighting with completing resources. So the facilities that are not connected to the grid, do not have any source of power. Those are the facilities that we do prioritize, at least for the first phase of implementation, because those are the critical facilities in need. Because you cannot compare a facility that is already connected to the grid, that at least has electricity, even if it's not reliable, with a facility that doesn't have any source of power. So we do prioritize those facilities in critical need, but we also, during our implementation, we do also install our solar suitcases in the facilities that are connected to the grid as a source of backup. So, yeah.
Thank you.
There was no question directed to me, but I will call upon us that we invite for innovation, which also fits for our local context, the issue of localization. Whatever we get should be translated into our local needs. Let's collaborate together, be open and transparent to what we are doing, because nobody can do this single-handedly. It's need the collaborative efforts.
Thank you very much, Emma. 30 seconds.
Asante, napenda kujibu swali la mshiriki wa kwanza kwamba nina manage vipi vaccine cold chain. Mnyororo wa chanjo ninautunza kwa kutumia gesi. Hii inatokana kwenye budget zote za mifuko ya serikali. Kwa hiyo ni matumizi ambayo yanatoka kwenye budget za mifuko ya serikali, Health Basket Fund, ambazo zina process mambo ya kufanya manunuzi ya nishati mbadala ya gesi. Lakini katika swala zima la sola, nafikiri tunaongelea labor ward. Kwa hiyo labor ward ndio sina nishati mbadala ambayo natarajia kuipata kutoka hapa. Lakini katika utunzaji wa chanjo ninatumia nishati mbadala ya gesi. Nadhani nimekujibu. Na swala la dada la nina manage vipi post zote ambazo zina vidonda na kila kitu. Kwa ngazi ya dispensaries hatufanyi siza sisi tunapokea wamama ambao tukiona condition hii ikoje nitampa rufaa kwenda hospitali ya rufaa. Kwa hiyo mimi sitakikea kidonda kikiwa katika hali ila naweza kutokea kidonda kikiwa katika hali ya mwisho ya uponyaji. Kwa hiyo ni kuja kumuona mama jinsi anavyoendelea na kumfanyia usafi na kumshauri na kwenda nyumbani. Lakini
response nzuri na pia kuongeza tu ile mafuta huwa mnakusanya pia fedha zile za uchangiaji process ya fund, kwa mnaweza kukalifia ile mitungi ya gesi kwa kutumia process fund. Lakini kuna solar refrigerators for vaccines also nowadays. So solarization is taking place, innovations and so forth. Dr. Sukari, 30 seconds please. I know you're a political doctor. Okay, 30 seconds.
Asante moderator. Of course, you have already mentioned about the issue of shortage of maybe for those specific which they don't have a grid, they use solar or gas as a source of power in management of vaccine. But maybe let's mention about the issue of how do they take care of the surgical patient. Of course, we know that after surgery, this patient is counseled by service provider on how they can take care of their wound. And of course, if they are discharged, they are also guided to go to the nearby facility for a service provider to take care of their wound. So that is what we are doing. That is very normal. And the last question is on how we plan ourselves to make sure that our health facilities can be able to have a solar system and again have the electricity on the grid. That is what we are doing. And our engineers nowadays, they do installations of whatever, doing wiring system, which can be used both for solar purpose and for the grid purpose. So that is what we are doing to make sure that we have all kind of energy sources part of pattern. Thank you.
That's wonderful. About again for the panelists, it's not enough. Again, the wonderful panelists. Can I have a group photo with my panelists, please?